Welcome. We are here today to discuss you and your role in safe opioid medication use and disposal. This training was developed by the Health Quality Innovation Network, or HQIN, the Quality Innovation Network Quality Improvement Organization servicing Kansas, Missouri, South Carolina, and Virginia. The Centers for Medicare and Medicaid Services, CMS, funds the QIN/QIOs to help local providers and organizations create healthier communities. This program will introduce you, the patient or caregiver, to be able to have support local efforts to improve patient safety and address the opioid crisis. So let's get started. A big thanks to the organizations listed on this slide for their efforts to support you and your healthcare. Today is an opportunity for us to interact, share information and ideas. I'm counting on all of you to take part in this program. So why are we here today? How many of you take a prescription or over-the-counter medications? Let's not forget those eye drops. Or if you don't, are you a caregiver or know someone that does? Well, this presentation is just for you. We can each play a part or improve the way we handle and take our medications. You probably have one of the most important roles. Medications are wonderful when used correctly, but can be dangerous and maybe even kill someone when used incorrectly. Disposing of medications incorrectly can also put others in your community, a son, a daughter, a grandchild, a neighbor, at risk or be detrimental to their health. Today, we are going to share together how all of us as a team can have a positive impact on safe opioid medication use and disposal. First, we need to understand what medications we're talking about. How many of you know the names of some of these opioids or narcotics pictured on this slide? Some of you may even be taking them. And if you have been prescribed the medication by your doctor and are following his or her directions, that's fine. Medication used correctly is a wonderful way to treat a condition. It can improve your quality of life. People with chronic conditions often need medications to help in treating those conditions. Opioid misuse often starts in the home, so safe storage and disposal are key to prevention. Make sure that the prescription opioids that you have are stored securely, and remember to properly dispose of all unused prescription opioids as soon as possible. The crisis we are in today. What else is your role? Here are some facts from a national survey on drug use and health published in 2019. They might surprise you as they reference some items about abuse, misuse, and addiction. 95% of people that are abusing or addicted bought it or was given their first medication from a friend or a relative. 32% stole it. You might not think about it, but other medications can be misused. Sudafed, gabapentin. Have you had someone ask for these? The most common main reason for misuse was to relieve physical pain or continue a potential addiction. Love can sometimes require us to say no or thanks for the offer, but no. Another big part you play in helping to stop or improve the opioid crisis is to dispose of your unused or expired medications as soon as possible. That includes your Valium and Xanax. The DEA holds drug take-back days, usually twice a year, in April and October. Use those months as a reminder to get rid of your expired medications and clean out those medicine cabinets. In between those drug take-back days, you can still dispose of medication. Don't keep the medication. We just covered on the last slide why that is so important. You have loved ones, friends people that come into your room or home that don't need to be tempted or have access to the medication. You have grandchildren that could be harmed. Here is a snapshot of the FDA drug disposal infographic. The link is provided to the right of the picture. You can also do a computer search or ask your local pharmacist for local disposal sites or disposal directions for your medication. The list of medications that can be flushed are listed on this slide, as well as the FDA link to the same list. You can search your computer for medication flush lists, or once again, ask your local pharmacist. And last but not least, there are additional instructions and notes about steps of how to best dispose of non-flush medications. You can mix the medications with coffee grounds or kitty litter in a container or even a Ziploc baggie. Then that can be thrown in the trash. Be sure to scratch off or cover any personal identifying information on bottles or medication packaging. And once again, if you need help, please don't hesitate to ask someone for it or contact your local pharmacist. For those of you that might have access to computers or relatives or grandchildren that could help you look up additional information and resources, here are some links. Remember, you are an important part of the team, both for your health care and for the health care of those around you. Some final safety tips about medication. Always read the label carefully and take as directed. Do not crush, break, or chew tablets or capsules unless directed by a healthcare provider. Keep medicines away from children. There are heartbreaking stories from poison prevention phone lines. Don't be one of those statistics. Store medicines in a safe, secure place away from heat and sunlight. Keep your medicines away from household cleaning products and/or your pet meds. Wouldn't want to accidentally take Fido's medication. Keep your tubes of creams or ointments away from your toothpaste. Wouldn't want to brush your teeth with that either. Using those accidentally has happened before, so be wise as to where you store your meds. Never take anyone else's medication. And last but not least, properly dispose of unused medication as soon as possible. Now for your part. I have mentioned earlier, each of you can have a huge impact in combating this opioid crisis. Here it is on this slide, homework and extra credit. I know most of you will want to be overachievers on this. So what are we asking you to do? One thing, get rid of those expired, discontinued, and no longer needed medications, especially narcotics, opioids, and medicines that can be abused. That's your homework. Extra credit? Get a friend, a relative, a Bible study partner, a neighbor, the list goes on, to do the same thing. You all have your circle of friends. Spread the word. Let's be a team and tackle this crisis together. How many of you are up for it and in? Let's all do our part and go for it. And last, but certainly not least, the local state contacts for community activities are listed here. In closing, please don't forget to do your homework and go for that extra credit. You each have a role to play in helping address this crisis. Please complete the program survey. It will take just a few minutes. You may also connect with HQIN for other information and resources. Have a great day.